Outsiders has been at the vanguard this year of trying to inject some realism into the hysteria surrounding the coronavirus pandemic. One day we will know the truth of this pandemic, and I suspect future generations will look at us with a mixture of horror and bemusement that we overreacted the way we have done, particularly in terms of the unnecessary damage inflicted on our economies and on our individual freedoms. Right from the get-go, we said on this show it was important to close our borders to China, but beyond that we should concentrate on protecting the vulnerable and allow the rest of the nation to get on with normal life so that the economy would not suffer. Alas, that advice was ignored, and the nation is now saddled with $1 trillion worth of debt that your children and your grandchildren will have us to thank for. Also on Outsiders, we have championed preventative measures to the coronavirus, including hydroxychloroquine and ivermectin. Ivermectin is used in a treatment developed in Australia by one of our own top specialists, Professor Thomas Borody, who was scandalously stopped in his tracks by health bureaucrats and officials for advocating his ivermectin treatment. This week, Dr. Pierre Kory, a pulmonary and critical care specialist in Milwaukee, testified before the US Congress. Listen closely.
We have a solution to this crisis. There is a drug that is proving to be of miraculous impact. And when I say miracle, I do not use that term lightly. And I don't want to be sensationalized when I say that. That is a scientific recommendation based on mountains of data that has emerged in the last 3 months. When I am told, and I just had to hear this in the opening sentence, that we are touting things that are not FDA or NIH recommended, let me be clear. The NIH, their recommendation on ivermectin, which is to not use it outside of controlled trials, is from August 27th. We are now in December. This is 3 to 4 months later. Mountains of data have emerged from many centers and countries around the world showing the miraculous effectiveness of ivermectin. It basically obliterates transmission of this virus.
Gather round, lefties, gather round, bureaucrats, gather round, politicians. Let me make this just really, really clear. On this program, months ago, we interviewed the man who could have saved thousands of lives and put Australia at the forefront of COVID treatments worldwide, right here in this studio. Yet he was mocked and we were ridiculed by the usual suspects of the left. Well, every Australian health bureaucrat and politician, hang your heads in shame. Sometimes I get a bit angry. I wonder why. Outsiders remain deeply sceptical about the climate scam, which in reality is just an excuse for greedy renewables investors to carry on ripping off the taxpayer, while the poorest and most vulnerable in our communities get shafted.